A question that I get often asked is, Tim, what sort of patient does really well in your office? And I know they're kind of referencing like, is it PTSD clients? Is it clients that have anxiety and depression? Is it even the chronic pain folks? And I would say it's not necessarily related to their diagnosis. It's more about their mindset. And what I mean by that is when we have our consultation and we are talking about, what's going on in their lives, what sort of pain are they having mentally and physically. And when we kind of come to this kind of fork in the road and I ask them a simple question, it sounds simple enough, but I ask them, okay, so we know what we don't want and what we don't like, but what do we want? It's kind of a stumper. But when someone knows exactly what they want and they're able to verbalize it right then and there, it's amazing. It's like, I know this person is going to do very well because they've already kind of thought it through. They've already kind of envisioned themselves achieving that. They just need a little boost, need a little help. And by the way, our coaches and therapists are great at cultivating that answer with our clients. So if you don't have it, doesn't mean that you shouldn't come in because you don't have it in your mind. We can help you figure that out. Anyways, so knowing where they want to go, it's just an indicator that they're ready. Also, indicators are like when I tell them, we expect you to journal. And if they're like, no way, I don't journal, it kind of tells me that they're not ready for the shift in themselves, the shift that I call the shift from what they don't want to what they do want. If you're not willing to do that, if you're not willing to, and I ask them to cut back on booze or stop drinking for 2 or 3 weeks, and they're not willing to do that, then they haven't hit rock bottom yet. And it's going to be tougher for them to shift because those two things, one's like a good habit, one's a bad habit. And if they're not willing to drop a bad habit or buy into a good habit, it's going to be tough to get them to shift because they're just so hardwired. The people that are kind of like open-minded, like, I'm ready to do whatever. You tell me to, jump rope, I'll jump rope. You tell me to journal, I'll journal. You tell me to quit drinking, I'll quit drinking because I'm tired of the way I'm living. And those are just a few things that we ask. There's some other things that we really want them to get on board with to maximize the effects of ketamine. So that's really the biggest thing. And so that's kind of what I kind of get into when people ask me who are the best patients. It's the ones that have the mindset ready to go. And again, that's not to say that we can't cultivate a mindset because that's what we do here for sure. But the ones that come in are a step above the other ones, the other clients that come in that don't necessarily know what they want and they kind of struggle to drop bad habits and pick up good habits. Have a great day.